Instead, the $1 million extra dollars that
be right there with you, man.
legislation
Sure.
somewhere got lost. That's not the employee's fault. That is definitely not the veteran's fault. Somebody up there has to answer for it. We must reaffirm our commitment to our veterans and ensure that the dedication of their care does not waver, especially in times of veterans and the community. Together, we make a difference. Let's raise our voices and demand the care and respect that our veterans deserve. There's a lot more important people here that need to speak.
Hello, my name is Wyatt Manship. Thank you for all coming today. This is just beautiful. We got people from all walks of life here. We got our residents, we got our union, we got Democrats, and we got Republicans. This should upset you all and outrage you. Enough is enough, right? Every day that we come here, we work here for the veterans, and we give it our all. And we are being cut to a skeleton crew. Our morale is very, very low, but we try. We try every day to work as hard as we can for these veterans. And we need Governor Reynolds to step up. Fund this place. We got a $2 million surplus. $2 million surplus. We were $1.6 million short. Plus, they got another $1 million they just got given to them on July 1st. $600,000 short. Seriously, this is what we do to our vets. Yes, and we need to get rid of this management. They're running. Cut the management. Do not balance your budget on our backs and the backs of our veterans. Thank you.
Now, and then we're going to hear from our veterans to see what they have to say. Today, luckily we have a beautiful day to stand here together and fight for our veterans. So as you all know, this nursing home trend is kind of spreading around our state of having too few workers to take care of the residents of the facilities. It's happening all over our state. But the one thing I have heard consistently is that this place takes care of people very well because they prioritize care of the residents. Is that what you've heard before? Yes, that's what I've heard. Right. So, basically, these cuts will lead to lack of service, which will lead to poorer care. And we don't want that.
Guys, I gotta take my phone off for a minute and adjust it.
We want to maintain our excellent care and have our veterans be absolutely adored and cared for by their caregivers. And that's what I think you all want too, am I right? So, I've prepared a few remarks. They're kind of long, I'll cut them down, I promise. Okay. So, it's our moral obligation to, as a society, honor and care for our veterans. Any actions that we take that reduce their quality of life are unacceptable and contrary to our values. Quality of care will suffer as layoffs of staff happen because lack of people leads to lack of care, lack of staff coverage, lack of outings, lack of everything that we want for our veterans here in Marshalltown. So some of the long-term consequences of this result in higher healthcare costs with poorer outcomes because of lack of staff. Just think about it. It's a kind of a cascading effect. Once you start cutting staff and care goes down, then expenses go up because accidents happen more and poorer outcomes are realized. So what we really want too is accountability and transparency. The decision-making process regarding these changes must be transparent and involve all input from stakeholders, including veterans, their families, and the staff. Accountability is key to ensuring that these changes are residents. Thank you for allowing me to speak today, and I will pass it on to the veterans who are lining up here to talk to you.
My name is Terry McCullough.
What do you say?
I'm originally from Bloomfield, Iowa. And one thing, about a month ago, I was in the 8th dining room, and I was talking about, I just think one of the head supervisors was a head supervisor, and one of the lower class supervisors told me to shut the hell up. And he's still working here. If that been an hourly person, they've been fired. That's gotta stop. And I received a letter the other day, and I don't have it on me, but I gotta remember in my heart. It says, Terry, you, the Legion, and President Council tell Commandant to fire Penny Bermudez. It says that we will be better off without her here.
Yeah! Get rid of that tyrant.
Commandant said, why don't you lay off everybody that makes over 100,000 and call them back to 50,000 less? Oh, I can't do that. He's got it, in my opinion. He hasn't done. He was down here today supporting his veterans. Instead of sitting in the air conditioning. That's all I got to say. Everybody, have a great day.
Police have asked us to be out in the street, and I realize you're photographed, but can you move it up just a foot? Thank you. Sure. You're fine.
Good to see you all here today. My name is Jake Knapp. I'm the second vice president of the resident council. And what I think is happening is a bunch of garbage. Because you take your rec therapists away, that means people are going to be staying in their rooms more because they don't have anything to do. Or they plan non-interesting things. Our rec therapists go to a lot of work planning our rec therapy during the month. And they take those away, we'll be staying in our rooms more, and there'll be more potential for suicide thoughts. And I sat on the board of a nonprofit program in Des Moines called Veterans Fighting for Veterans, where we're trying to lower the suicide rate of all veterans. And I have one question for the governor. What are you trying to hide that you will not let the state auditor come in here and audit the books? Yeah! And he won. And from what I heard, the person who filed the false claim against him only got a 30-day suspension. In my book, if you file a false sexual harassment charge, you should be fired. Yeah! Amen! If they'd have just took a 10% cut in administration wages that they get, they could have saved all these jobs they're letting go right now. Yeah! Because the figures I've heard is administration makes over $3 million a year. A 10% cut would be $300,000. They'd have to give up their money. And the cuts the rec therapist have to take is $25,000. Well, that would save 12 for a rec therapist.
And the chaplain. And you get the chaplain.
And the chaplain. These are residents.
Thanks for gathering for this, and I'm David M. Johnson. I live in Fox 2. Been in
They've laid off 13 people.
home for over 31 years, and I'm sick and tired of the administration's policy. Plus, I have been here with 12 communists old that's been on the IVS administration. I think it's time to stabilize and get them down to earth, but it seems like it don't work. But hopefully this will push a little at them. Thank you for letting me on today.
Thank you, David. Thank you, David.
Guys, give yourselves a round of applause for coming out for our event.
That thing ain't working.
Thank you very much. It's very much appreciated. We got one more employee. Ex-employee that wants to speak.
Hi, I am Becky Laguna. I have about 12 years total experience at the vet's home, and that is in the nursing department, ranging from resident aid all the way up to nursing clinician. The last time I was here was a couple years ago. I only stayed about 9 months. My heart couldn't take it. I started here in '99 as a resident aide, and the care that they received, I would have backed with a heartbeat. I mean, everything was about the residents. The people that were here were about the residents. Every decision was what's the best interest of the residents. I didn't see that the last 9 months I was here, and I tried to fight it. Took all of my concerns to management. I fought with management. Several of them I got overturned. Some of them I got overturned. The other ones I couldn't fix. And I felt like I was mocked afterwards because I got calls and emails from management saying, "Good job advocating for your resident," when it was something I shouldn't have had to advocate for. It was something that should have been a standard that has changed and no longer a standard.
It's got a short now.
And they're pushing on the off button, squeezing too hard when they get nervous.
It's running out of juice.
Yeah, well, I don't know how to use that diet. So I'm here because I love the veterans. I love this place. It is important to me. I know they have ran these 20 nurses.
How's that busted? They dropping off residents?
Some more amazing nurses out of this place. And this manager that did it. Yeah. I love these people. I love our residents. I am proud that I served for 12 years. I'm sad I'm not here anymore.
Oh, there's security.
Thank you. Hey, what? Oh, is that race talk? And that business I've been here with thanks, Ray. You bet. 2022, September 22. And the one thing Thank all you guys for coming out and showing the support for these veterans here. I've been here about 10 years now. I am actually on the phone, but I'm on break right now, but I'm not afraid to speak. Everybody's Here's what I'm saying. I'm glad to see this protest, and I'm glad to see the bosses out. But don't forget, guys, when we go to the polls and vote, you got to know what you're voting for and who you're voting for. You got to know what your job is on the line. Who's going to take away your job and who's going to give you a job. That's where it starts. It starts right here with the protest. But we got to continue to carry this on into the election hall, and we got to put in people that's going to secure jobs. I see the sign say secure jobs. We got to find who's going to secure jobs and not the ones who want to take a job. Not the ones who want to continue to get one at the top, all the money. You know, if we look at all the money that Jake was saying at the top, and you look at the people that's getting cut, those people need a job. When you can walk in and we got 380 residents, 400 now,
and we got one chaplain now, and there's got to be a counselor, a minister, you know, all this to all these people, plus employees work there. And you tell a pastor that he's got to go. You know, that's to me, that's low. Because people need counseling, people need spiritual in their life. And if we don't have that, then we don't have nothing. Because some of these folks, some of these people here need something to hold on to. This is they come here to live their life out. And what are we treating them? How are we giving? What are we doing for them? Are we really for the veterans? Are we really for the veterans? I've been here for 10 years. I understand what and I've advocated for some of those folks in Washington, D.C., other than politicians, to come out and tell these guys to thank you. And I've been here for 10 years, and you hardly ever see that happen. There's not a gentleman that I know that's been here to say thank you or sit down and have a meal with them. It's about the veterans. That's what I was told when I first started. It's about the veterans, but I think we done got away from that. It's about keeping the ones that talk and come, keeping them with their pay. Let it go, guys. Let it go. Let it go. Don't ever let a distraction like that stop. Keep your mind off the focus. The focus is about these veterans, not about that loud music going there. Just let it go, guys. Don't focus on them. That's a distraction. We don't. This is what we got to talk about is the veterans. But I got to get back on the clock. And once again, I'm always looking to talk. But I'm all for you, Jake. Jake, no, I'll go out to wait for this man, whatever he needs. Terry, where you at, Terry? I'll go out to wait for these guys. What they need, I give it to them. Yeah. What they need, I try to get it. That's right. Whatever they need, I try to get it for them. But I want to see that come from the top. I just don't want to see them say you care about the veterans, or say it. Actions speak louder than words. That's right. And I let my actions say when I go there and do all I can for every one of these veterans in here. I'm just telling you guys, it's a great rewarding job to be here. It's a rewarding for me, and I just love these guys. So I'm just telling you, we got to take this to the poll too. Right now, we got to continue to protest. We got to continue to put our voice out there. But come election time, we have to know who's going to take those, ones that secure jobs at. Who's going to take those jobs, protect those veterans' care? We got to know who's going to do it, not those Washington, D.C. slickers, those slick slickers with those nice suits on. They ain't going to protect your job. That's right. It's going to be people like you going to protect these
Ray for governor!
Y'all continue to do.
Thank you, Ray. United States Marine veteran. I'm a former.
What's up, man? How you doing?
Great job, great job.
Insanity. When you have nurses, and there's a dedicated nursing staff in here, when you have nurses working 12-hour shifts, 14-hour shifts, 16-hour shifts for 8 days in a row, that's a safety issue.
Yeah, that's right.
That's no bueno. That is a safety issue for our veterans. Do we have any coffee drinkers here? Coffee drinkers? Yeah. They took their liquid coffee creamers away for budget cuts. To a coffee drinker, that's like taking cigarettes away from a 30-year-old smoker. People were losing their minds, and it was budget cuts. Now they have these little flimsy packets. You put it in your coffee, you stir it up, you drink your coffee, and there's sand in the bottom of your cup. Who's making out the budget here? Liquid coffee creamers are a huge budget item? Come on! Nursing staff, the safety issues. I would go into other units here. I would go into units and there would be a nurse in the unit. And I go to the next unit, no nurse. And I finally find a nurse and I say, where are the nurses? Only had them, there was a bunch that called in. I said, did you notify somebody? Oh, it's being taken care of. What's being taken care of? We have residents that are without nurses for an hour at a time. That's unacceptable.
Right.
Somebody is lying to somebody. Let's just take this. If the nursing staff and the nursing supervisors are reporting these violations up the chain of command, who's erasing those violations? Who's not reporting this to the governor? Two things. Either they're telling the governor the truth and she's looking the other way, or they're telling the governor lies because she's not here supporting the veterans either. Thank you. Thank you.
Next protest, somebody needs to get a machine that works.
Well, they're squeezing the microphone. There's got an off button on there. I used to have them just like
My name is Michael.
Say it ain't working.
I'm following up on the fellow that said it's time to get the book. I'm here trying to be the next senator for District 26, Marshall County, Story County, and I'm here to support the workers that protect our veterans. I don't see Senator Edler here. I know he's retiring, but he's still our senator. He didn't feel like he should show up and support you in this. Wow. I don't see anybody else saying, let's support our workers. Let's support our workers who take care of the veterans. We made a promise to these people to take care of them when they made a promise to us to fight for our freedom. And here we are falling down on it. Not because you all aren't doing your jobs, but because the governor won't do hers.
You know that lady?
Yeah, that's right. That's right.
It's time to send somebody to the Capitol that cares about y'all, that really actually puts their actions where their words are with the veterans here. Impeach the governor! We need to fund this place because it's our duty. Not because, oh, well, it's the right thing. No, it's our duty. We owe it to them, and it's cowardice for Reynolds to not show up. We deserve better. Impeach the governor! Impeach the governor!
We're going to have to help him get a little closer here, guys.
They're a team.
That's what I mean. But she knows how to get away with shit.
I can't believe I went in one day to see
about 3 years ago.
me into the
I spent 4 years in the Navy in the late
and
90s.
she had the
And
gall
I
to
spent
offer me a job.
all 4 years sailing in South Vietnam.
Talking to somebody that's never been qualified to do what she does.
There's no way in hell I'd ever go back
I
in there again.
got sick in the 50s, and I got sick.
Again, it's gonna help me go after this case. And so I said, realized back I said, so what do I do now?
Guys, if you're watching this, these are the people that this administration is letting down.
If I'm killed, they'll bury me. If I'm injured, they'll heal me. And if I'm sick, they'll heal me. Today, I'm finding out that all of those promises have been broken. I got Parkinson's.
See those assholes sitting out here watching this?
They're doing it.
Yeah, they are.
Just got back. I don't know where we went for lunch today, but it was good food. I was out on the freeway, and it was a great ride. And, it was just a fun experience. And I don't think
I don't think they really care.
when I do have money, I go on them. I don't
Yeah, that's why they have to say leave.
That's why this town's run the way it is.
Somebody else said it. I just sit in my room and I sit in a recliner, and I learn how to take care of the temptation, and I've tried to kill myself many times. And I finally went to AA 40 years ago because I thought, well, hell, if I can't even kill myself, I might as well get over it and go to AA. And celebrate 40 years sober.
Yeah.
So I think I would check the IBH like square in the ass and make them come to face us because we need their help and we need your help. And some people
you. Thank you for your service.
Keep on walking though, baby. Doing better than I am. All these guys out here are just like that.
Say whatever you want to say. It's a free country.
He's calling him out. No, he won't. You can say whatever you want. This is a public place.
Well, senators
They just like people to think you're going to be in trouble. He might be because he's still here, but he probably already is. So.
Take it back.
Are you for or against this, Commandant? Because we need to know.
Here he comes.
You know that I stand with veterans, period. Wyatt, I know you know that.
I know that there's a good man under there. I've seen you sit with dying people, stroke their hair. What this, the rest of this administration is doing is not right.
These same problems have been here way before you came here. We're not blaming you, but there's a common denominator with it, and you hear what they want you to hear, but you don't ask the employees what's really going on.
One clergy for
I do ask the employees what is going on.
C4.
It's not a statement what you just said there.
I didn't hear you go.
Staff member that's sitting out here knows that I give ample opportunity for somebody to.
What about the C4 cards you didn't cover that you were told were just hostile employees? Seriously. And some of the things that are going on now were in that box that never got handled.
I have answered every complaint that has been given to me. Every single one of them.
Then you didn't get all of them.
If there's a staff member out here who knows an issue that I've not addressed, I want you to raise your hand and tell me what that is.
That's why they're all here.
We have a
Okay.
Yes,
people getting cut.
she wrong.
There's no activities
With
department.
retaliation.
Not true.
True. True. True. You got 30-year people here that are contradicting what you're saying.
Tell us to go work at Casey's. Do you value? Yeah, you did. Do you value your employees? Then listen to us.
I absolutely value
Then draw a line in the sand.
This is good, boys.
Have transparent management and let the employees not feel like they can't say what they want to say.
Who does not feel like they can share something with me? Raise your hand right there.
I'm not here,
You
but
said that?
I can't feel like I am.
Tell me why. Here's a common comment made to me. I'm afraid to share something with you because I am going to be fired, right?
Right.
Give me an example of somebody who has been fired as a result of sharing a
I can
challenge.
tell you 20 nurses' names right now that were pushed out of
They were here for 20 years.
Okay.
Yep.
So you hear what they tell you. That's the problem. Honestly, you should be on our side.
Alright, this is a great job. If you ask these residents that are out here, where am I not getting support and care? They're going to answer, I am getting what I need.
Creamer?
I'll put you on the spot. Bobby, Terry, you guys know there is no better place for a veteran to live than. There's no question about that.
And run it into the ground.
That is not true.
for the state, and we're cutting jobs here. Why aren't you standing up to the governor and demanding that we keep our jobs, that we help our veterans, that we increase on the program?
Why are you begging?
We are not terminating any programs to support veterans. That is an inaccurate statement. That is not true. Every program that we have, we continue to have.
No, you're cutting up. No, our TRSs where you don't value them. You cut them, and you're making them reapply for the positions, and there's not enough to go around. For aides and assistants, for less pay.
So
it's not right.
He doesn't see the picture because he hasn't been here that long.
Yeah,
right.
But they cut it. They cut it. They
All
cut
these
it. They
people,
cut it. They
make
cut it.
him get out on the floor like the last Commandant. Be a leader.
Yeah.
No, you're not. You're not out on the floor. I'm on the floor all the time. These people on the floor. They hide in the offices.
Not true.
Yes, they do. Sarah Bruner. Yeah, all of them.
A loud voice does not mean that voice is true.
Vote on it.
That is not a true statement.
But
Not true.
our experiences are true. All of our.
When people are out there speaking,
I can tell you that there are people that work 16-hour shifts here that want to do exactly that.
I know it's a dedicated stuff.
Yeah, absolutely.
There's a huge McDonald's ass here, and I got
You know him?
reprimanded for wearing
Who?
the wrong color shirt.
I know a hell of a lot of people that work 16 hours.
That's not the reason that you're no longer employed here. I guarantee you that. You know that's not true. Okay, there you go. I'm not tired of being reprimanded. Okay, there's all kinds of stories out there. When I've been asked for facts, give me a who, what, when, where, why, and how. That is never delivered to me. Never one time. Penny Cutler Bermudez worked her rear end off.
bullshit.
Okay? Who said that? Who said that? Okay? Everybody's got an opinion, and she has one. And that's great. Continue to have it. But what I'll share with you is that give me a who, what, when, where, why, and how.
I wonder why someone is talking to you when you treat like people like this and point your finger at them. Fucking listen.
I'm listening right now.
I know for a fact.
I'm coming out in front of all of you. I am coming out in front of all of you, providing an answer.
I
Go ahead.
I'm a fire nurse here. The last stint that I was here, every time I've left on my own accord for school or whatever, the last time I was here, I had a resident's wheelchair yanked from them by management, and he was laid in his room for 3 weeks. And I was told by Penny that I had to document that we were meeting all of his needs. And every day I documented. He doesn't have a mobility tree. He doesn't have any means of mobility because they took his wheelchair. So you tell
That
me
happens. I'm going to tell you, we do take people's mobility wheelchairs.
Why are you
That happens.
yelling? So why was he left for 3 weeks without anything? You look up his chart.
I'm not saying you didn't. I'm saying that. Okay, you got you have a story.
I have 5 stories like that.
I have. Okay. So I have looked into many investigations where we've had staff that have left unhappily. I have never found one where I'm like, wow, we did a disservice to this person. I haven't found that. I want you to know that's true.
Take care of them.
Many of the nurses,
Take care of them.
many of the nurses that are here 20 years that left never got an exit interview.
I provide everybody with an opportunity to have an exit interview. Everybody.
We're the ones that make this environment pass the VA inspections, the DAS inspections. We're the ones that make you guys look so glorious. But you guys say, oh, isn't the leadership so great? You never, ever say thank you to the employees for
Okay, you know that's not true. You know that's not true.
I know for
Why?
No. You just said we never show appreciation for the state inspections.
outdated granola bars.
Recently did not say anything about the staff.
Go there.
It praised your leadership.
For what? For what?
Are you aware that in Aubrey, there are no nurses on some of those units for extended periods of time because of the nursing shortage? Are you aware?
Our nursing requirements on every floor, every day. Period. That is true. No, that is true.
I deliver the food trucks. They say we haven't seen it for an hour. Go to the next unit, no nurse. The third nurse then says, we had a bunch of call-offs tonight. I said, did you report that to somebody? Yeah, they said they got to take care of.
Okay,
They
so
said they got to take care of.
So we exceed the standard in terms of required nurses on the floor, period.
Because,
so I don't want anybody to walk away from this
because
thinking that we do
because
not
on your
meet the
papers,
requirements.
Somebody's hiding and not telling you.
it's the document.
And I do not believe that's a true statement.
I'll tell you, I'll testify to it. I go into
Basically, he believes his administrative staff and not the people that are actually doing the work. That's what this boils down to.
Correct.
And you're not going to change his mind.
We chose the IBH, and they're not. They had the college. The IBH employees that come here every day to take care of the people who fought for our life, who fought for yours, who fought for ours, who you included, or whatever. And they're being, and you want to lay all these people off who give a shit about these guys, or cut their pay, or hire cheaper staff. It's baloney. It's baloney. There's been commandants in here that's just ripped this place off. You just gotta dig through the muck and find it. You know? You just gotta dig through the muck and find it.
Well, they do.
If people that care, obviously, look at all these people.
I got a question.
That's why they're doing it.
I got a question. With no disrespect, why you came out here hostile? Why? No, you're interrupting me. That's hostile. No.
Hang on, he has a question.
Yelling at me with a bullhorn.
Nobody's yelling at you with a bullhorn now. I'm just asking, why are you so hostile? Maybe these people might be right. Why the hostility? You automatically aren't believing anything they say. Why would they make this stuff up? I know for a fact that our floors were so short one day, somebody put out an email that we needed help feeding residents doing this. And administration went out to lunch that day to celebrate the zero deficiency survey that we had and didn't come up to help. Why?
I can't tell you.
I mean, what's that? That's a slap in the face to the resident. I mean,
But Ulrich's fully staffed too. Yeah, Ulrich's fully staffed.
They're not.
This crowd wouldn't be here if there wasn't any.
Yeah, exactly.
time and time again.
I mean, the issue, let's get to the bottom line. The issue is that we've got, out of a staff of 700 people, we have 15 positions that are being realigned. That is a fact.
A department.
11 that we're eliminating and 7 that we're rehiring.
But how many management? Including supervisors.
And why have the number of supervisors almost doubled in the last 8 years with less employees and less residents? Why have the number of
Something you have to understand is that at one point, less than 5 years ago, there were 500 residents living here pre-COVID.
How many are there now?
400.
Why do we have double the supervisors then? Why do we need? Damn near. Oh yeah, we never. No, when I was on third shift, there wasn't even a supervisor. Now, how many do you got on third? Seriously, we didn't have a They had a one on call. So don't tell me that you guys haven't almost doubled supervisors. That's ridiculous, because they have.
Yeah, we have not. But, okay.
Well, we can FOIA request that information, and you're on record saying that you haven't. Good.
I've had nursing people on Ori tell me that they were put in
Less supervisors to put more
an
nurses
Ori
on the
1, 2,
floor.
or 3. Those are locked Alzheimer dementia units, all by themselves to deal with all the residents in there. One of them had a heck of a time because she was trying to toilet one of them, as she's having another one having an episode, and she was in that environment by herself. And now we've discovered that they're not getting their schedules on paper where it might show that that person was in that unit by themselves. Instead, they're putting their daily schedules up on marker boards so that there's no sign and the girls can't print them off as proof that they're being
By
forced to
themselves.
work in Ulri units and other
Getting rid of the
units by themselves.
documentation.
That can't be true, Jen. Ulrich is fully staffed. This man told you that.
Sir, I hate to tell you, but the administration has been putting perfume on a pig here.
Yep.
Honestly. I mean, we're begging you to listen to these people with an open mind. Though you already. That's not true. That's not true. When we know most of it is.
Okay, that right there, you said I know most of this is true. I know that is not true. I know there is so much information out there that is inaccurate. About the Iowa Veterans Home, this is the standard for long-term care for a veteran, period.
No, it's not. Federally, downtown Des Moines it is. Why can they get funded, but we can't?
Get out there and look at more
I am out. I am looking at all of them. Why federally do our vets not have issues, but we do at the state?
Why would you request that to somebody who probably comes to work every day and takes care of our veterans? Why would you request
Because
that
she's
she
just
doesn't-
making a comment.
I'm not. I actually do know it's true.
It's an
And I asked you a
example.
question.
It's
Why does the vets home federal level not have the issues that we have here?
They weren't afraid to lose their
The
jobs.
Veterans Home at the federal level.
Correct, in Des Moines. In Des Moines.
That's not a veterans home. That's a VA hospital.
Don't they have long-term there too?
They still have long-term care there. They have long-term care there. Why do they not have the issues that they have here? I have seen the issues here for 8+ years, and it's the same over and over and over, because your side of the table, respectfully, is not listening. If you sit down and listen to folks with an open mind, we can actually get somewhere. I am asking you to do that with your staff, with your veterans, with the staff's union. Sit down, make time to hear what all the issues are.
I would also say, over the years, there have been several high-end positions that have been made up or made into new positions that could easily be cut before we cut firsthand staff that are working directly with the residents. So maybe you should look at some of that. And when they
So what are those? I'm curious. Just share those with me.
There was a COVID one. I know there was a COVID one about
her job was created.
The quality and compliance.
We already had compliance officers.
And we have more compliance requirements.
How when we have less residents?
Well, the requirements don't change based on the number of residents. We have an 800-page document that we're required to adhere to in order to meet Center for Medicaid and Medicare Services requirements. That's true.
How about the position that was created for Brett Shutt to begin with that's now being filled? Why was that one filled?
Why?
Why was that created?
You know, it was created before I got here. My understanding is
you
that
were here.
There's been many of them over the years.
Food service down to HR.
Maybe I was just getting.
They created that job.
Why do we have that specific position? Because there's a lot of investigations that take place in the facility.
That's ridiculous. I've never heard of a place that has somebody that just investigates their employees. That's a huge morale. And then they come up on the floor with their clipboard. They don't come up to help. Somebody knows they're in trouble for something.
I agree with you.
I mean, discussions that can be had.
I wish that we did not have to have an investigation on our facility. Unfortunately, in long-term care, that's a routine requirement. Period. You just got to do it.
That's the first job I've ever heard where that's the person that's in charge of investigations. Is it because the HR person isn't qualified for her job?
No, it's just that there's so many other requirements.
No.
We have one full-time person that does that. Period.
I'd love to sit down with you sometime and tell you how I was targeted.
Okay, I would.
I'd love to.
And here's the thing: when people have these individual situations, I'd love to learn more about them. Because what I do hear all the time is that, oh, veterans are being abused. Veterans are not getting what they need. There is now a lack of support for veterans. All right, and that is not true in these hallways.
You know what?
It's just absolutely not true. I am here every day, and I can validate that from my own perspective.
From my own perspective, I can.
Can one chaplain minister to 400 residents?
No.
Minister to the sick, daily services, weekend services?
Nope.
Can they do that? Why would one chaplain say no? Can you answer?
Yeah, we will have one full-time chaplain, and we will get the rest from outside the facility in a contracted basis.
Has to do all the contacts. You might need a Catholic priest. I need a Methodist minister. I need this. I need that.
No.
Who's doing that?
Our clinical services.
I hope for the love of God that this guy is sincere.
It's gonna work.
I have a comment and a question. The last comment on that, you did a very good job.
No, that's not true. Administration did not run him off. I did. I think that there were a lot of things in there that are inaccurate.
I don't think you'd believe it. Your administration does any wrong no matter what.
Why is that? All this huge group of people here are making stories up in line.
Yeah, I see
But your
50 people
administration
here
is also
that may or may not disagree with
he's
what's
worked here.
being
He worked here
indicated, right?
over 35 years.
You know, and at the end of the day, I work for the will and pleasure of the governor, right?
I thought you worked for the veterans. I thought you were for the veterans, not the governor. Veterans. Shit.
It's on video.
He said he works for the governor.
That's well, brown nose.
Wow.
Yeah.
Yeah. Yeah.
Okay, so as a union rep that represents most of these employees, would you commit to bringing back labor management meetings between labor and management to get across the picture and discuss these issues in a neutral environment?
I'm willing to meet with individuals who have a specific complaint to address specific issues.
They're afraid. Let them do it in a union.
No, that's not accurate.
They're afraid.
Why are they here if they're not afraid,
Listen to him. Let him finish.
Just because you have a loud voice, dude, doesn't mean you're right.
I've been a union rep for 16 years.
He's not going to believe his administration does anything wrong, no matter what. No matter what the track record is.
Here, what I'm hearing is you don't want to do that because you want to listen to people individually. Well, people are afraid to come to you individually. That's our job as a representative. If you agree to sit across your line, we used to have labor management meetings, but those went away. Would you agree to bring them back? A small group of people having to talk about what's wrong with the vets home and how we fix it.
Thank you for your professional and polite manners, sir.
thank you.
Okay or not?
You're a good leader.
I was hired to lead the Iowa Veterans Home, and I feel like I'm doing exactly that. It's a decision I can absolutely make.
I hope that you.
I don't have the bandwidth to have numerous meetings with a large group of people.
I hope you're here. I hope you're here for the residents and the people that show up every day to take care of them. I hope you're not here for the governor.
Okay,
I hope
let me
you're
ask.
here.
Okay, these residents out there, who am I out there for? Do I advocate for you guys? The governor. Right here. Right here. This guy will tell you. I'm advocating for him all the time. Bob Pleasant, same thing. Right back here.
I'm just stating what
I'm
you
with you
said.
guys all the time. So, I mean, here's the way this gets couched, is that we're not advocating for veterans.
He has something to say. You used a name.
Bob's got an answer. Hey, Bob's got an answer. Bob's got an answer different than the governor's.
I just got a question.
Say it.
I was here 20 years ago because my doctor not a needed vacation.
Say it. Say it.
20 years ago, I got $140 a month. 20 years ago. This month, I only get 140. I get notices in the mail every year about my Social Security hike and how much more pay I'm going to get. Where does that money go to? Do you get it?
I'm pointing at the
Jesus, he's like a little kid. He really is. Not professional at all.
Okay, so the cost of living inflation. If somebody is not living here at the Iowa Veterans Home,
Do you know who that guy is?
they're living out in a traditional nursing home. Anybody that has relatives that live in long-term care facility, they're going to tell you they get $50 a month. Anybody that lives here is going to get $140 a month. That's true. It's not changed for 20 years. Yeah. Everything has gone up. Inflation, everything.
Don't you help this for the governor that we have what we have? Everyone's looking to bring that over here.
I'm a veteran myself. I am a veteran. I served 33 years. I know what you're talking about.
And respect your brother.
I'm absolutely. What are you talking about? Respect my brother.
And work for them, not the governor.
Yeah, I am not interested in sitting out and having a meeting. I am interested in sitting out with individuals who have these.
So then you can say it when it happens.
Right?
It's called manipulation.
Yep. Showing up.
I don't want to go there.
That's like putting perfume on a pig.
Good photo op.
Put that in the paper. He's got to get Penny out here.
I'm sorry.
30 years.
Okay.
Use your bucking right.
All right. Hey, thanks for coming out. Oh, you appreciate you.
Sir, can I have your name? Can I have his name for the record? Yeah. What? You work for the public? Then you need to
Find out about this. You may be on the chopping block. Ready?
Because I'm doing a news story.
I have no idea.
But she's up there in Milwaukee.
Kissing, you know what?
And how long have you been here?
So you're turning this into a political.
Well, it is political.
It's political.
Yeah.
They've been going on for years. Your fault. Came and there's one common denominator that's been here for a long time. And until he listens,
They're not stellar. You keep on chipping away at them.
For people to come work on. There's a reason for it.
Yeah, I'm saying I work here. I work on the floor. You hide in that office.
This thing's...
It is
that's
not true.
These
Yeah,
things
it is.
these people are saying, I can
Yes,
vouch for
then get out
85%
there
of
and
the rest
work.
of them I don't know.
Work like the last commandant that Penny chased out, and the commandant before that she chased out. Yeah, she ruined both of their careers. Yes, it is true, and you know it. Oh, Jerry was a good man. Oh, Jerry, Tim and O'Jerry. Who? You don't even know? Matt Peterson was a good person.
Absolutely.
Yeah, and he says that his one mistake is not getting rid of that admin team.
Okay, he's wrong about that.
No, he is not. No, he's not. He is not. You got all these workers saying that, and you're not listening again. And you won't listen. No, you won't. You will not listen until you're forced to listen. No, you're buddying up and telling people what they want to hear. You're still sticking up for them.
Quite obviously not telling you all what you want to hear.
Yeah.
That's true.
No, you're just being, and they just ask you who you work for. You said the governor, not the vets. Yeah.
That's a true statement. I work for the governor.
Yeah, you work for the governor, not for the vets.
You work for the governor.
Do you think these employees...
Remember when we say we care about our vets?
Well, then listen to us.
And that's why I'm here talking with you, okay?
You're shouting them down.
Well, he came out with an attitude right off the bat.
Yeah.
Like...
Yeah.
You think that people say, oh, here he comes, he's coming up to Malloy 4 North. No,
Yes, they do.
No, because I don't even know where I'm going sometimes when I leave my office. Well, there you go.
Well, did you go work in the kitchen, go get your CNA, and go work with the staff, see what the real problems are, and get those rest of the people out there, like Penny and Sarah. What you think? Yeah, she.
No!
They are not. To intimidate and retaliate. You know it.
I know that's not true.
Yeah, it is true.
Just because you're talking loudly doesn't make it more true.
Yeah, it doesn't matter. I got a loud voice, but apparently you're deaf. I gotta yell for you to freaking hear me.
I can hear you fine.
No, you can't.
I'm just telling you.
You cannot hear.
You have an opinion, and it differs from mine.
Yeah.
Period.
No, it's the truth.
It differs from ours.
Hey, Todd.
Maybe Wyatt should take over his job.
At this point. They're allowed sick time. They call in sick, told not to come to work sick. And then when they do call in, they get put into a full pull program.
That's true.
I have a question.
They're punished for death of a family. If my father were to die and I called in, I'm on a mandate list for a month. Am I not human?
No.
That is punishment. That is retaliation.
A worker broke her ankle, and she happened to miss 2 consecutive, like 2 weeks in 1 month, 2 weeks in the next month. So she comes back to work, and she's on the mandate list, so she has a healing fracture, but she gets to work 6 days.
And you know who put together that mandate policy?
Where did it come from?
The nursing team put that together. And I'm talking about...
For COVID, and it never has been taken away like it was supposed
Okay,
to
so
be.
that's the fact.
You're saying the nurses want
The
it?
nurses team put that together, and it's not just the administrator of nursing.
It's still wrong. You're in charge. And I would never, ever. I should be allowed to be human.
No, I agree with you. But I'm also saying that there are people who show up on time every day for work and don't get mandated. They don't get mandated because they're here every day on time.
Well, I'll disagree.
Sometimes people get sick. Sometimes people die.
They tried to mandate me on my last day of work when I was retired.
Well, the young
We
lady
follow-
that
we
I'm
follow
talking
the policy, period. We absolutely follow the
Because if you can't mandate me because if I came to work, then you say it's a
Sorry, guys, I got sun glare in the screen here.
But you have supervisors that call in 22 times in 6 months, and they come and go as they want. I mean, that's not right. Everybody's human.
I got a question.
The young lady that I was talking about, she had been here. She was taking and volunteering for all the open hours she could afford to do. She missed 1 damn day and had a month of mandating.
Okay, so I guarantee
That's
she
not
wasn't
right.
mandated for a month. I can almost guarantee you she wasn't getting 30 days of mandated overtime. She may have gotten mandated in process, but not for 30 days. Yeah, Professor?
This isn't how you show that you care, sir.
I put in 30, 40 hours in a pay period, extra time. My truck wouldn't start one day. I'm on the mandate list for a month, and they go through that list because
the mandate list was put together during COVID. It was supposed to end when the COVID pandemic ended.
No, I don't think so. That policy didn't say for COVID. It said mandate policy, period. So,
no, it was developed during COVID.
Okay, that might be true. I mean, there's always been.
What about bereavement?
Well, you know,
What about
I'm not able to talk about all these
if any employee has to take the time off work to bury their father, their mother, their spouse, their child, they are put on the mandate sheet, and if God forbid that their funeral be held on a weekend, because you're going to make that up if you use your bereavement. Also your sick time. Or how about when they go out on surgery? If they have to have surgery and they're off for 6 weeks, and they come back, they have to make up every single weekend that they were off work for having surgery. It's a punishment
for a funeral of your family member, and you're saying that's right?
Okay, I'll share with everybody. We've got staff members here who have been here for decades that are sitting on a zero balance on their sick leave. Zero balance, right? Right, zero. They got
What's that tell you?
What does that tell you?
Then the mandate list wouldn't matter to them because they're never here anyway.
Yeah, that is part of their compensation package, just like their paycheck. I know I'm right.
Yes. Nobody should be punished for going to their mom and dad's funeral.
Hey, Benjamin.
I don't think anybody's getting punished for going to a funeral.
They get put on the mandate list.
They're on a mandate list.
And they have to make up a weekend.
What is it? What is it? What's your opinion on it being on the
It's
mandate?
covering down on a requirement. There are veterans here who need to be taken care of. We have a requirement to have a certain number.
There are employees here that need to be taken care of as well.
Okay, so is our staff so low that a couple people need to take bereavement?
I have a question.
I worked for Electrolux for
Or a
7
spouse?
years.
Is it so
Whenever
low
brother,
that you
sister,
have
or
to
mother
have them
died.
mandated
Okay,
in
so
order to
that's
make
this
the
comment
coverage?
that the morale is so low.
We got 3 days off.
I'm not hearing that. I'm not hearing that this morale is so.
You're not listening.
And they're afraid.
You're not listening or looking, Todd.
No, they're afraid. They're honestly afraid to tell you. No, it's not.
It's not
Ask.
an opinion.
I have heard many workers today admit that they're afraid to come.
They are.
15 nurses that want to be here, but they're afraid to be here.
Also, I have a question about policies. You say you follow them. I have emails to Penny and Sarah admitting that they can change the S10 policy to meet the needs of the facility.
Yeah, we do. That's right. That is a
So
true
you
statement.
can change the policy.
Yes,
You
you're right.
don't follow it all the time.
No, that's not true. We do follow the policy, but we can change the policy, and we have changed the policy.
Are nursing supervisors nurses? Do they have any mandates?
Uh,
I mean, yeah, they can work before, but when they have a loved one die or have to stay home and do whatever, guess what? They never get mandated. That's not right. That's not right. Everybody's human.
I got a question, please. I want you to, in all seriousness, go on record and tell me that none of these residents or employees are going to be retaliated against for being here. You guys heard it? Nobody's going to be retaliated against.
I know for a fact.
Exactly.
You know, let's call it a day. And then 2 days later, they're getting threatened with their job.
We got these people over here. Most of them. Some of these are probably administrators that are too afraid to come over.
Well, there's nothing I can do if I don't know. Here's a common thing.
This is the Commandant, by the way.
My leader.
He's fairly new and really don't know what's going on around here.
Bad example, on and on and on. Okay, and they give this to me so I can make a response to it. I read this card, and I read it, and it's like, okay, what do you do with that? What do you do when you just got a unanimous comment from the peanut gallery saying, my leader is terrible? Does the person work in laundry? Do they work in a quartermaster?
Well, I know there were specific ones put in there that I did that you never answered.
That's what they're afraid of, not you.
I never was Penny on my shirt tail.
But you know the director of nursing threats their nurses that if they get promoted, that they can't guarantee Did you know that? When they went to the new role and made a clinician and a supervisor, she held a meeting with the clinicians. And if we chose not to promote and support the new mission, she can't guarantee we'd have a job. Even though I'd been here 28 years.
Oh, you can't be telling the truth. Come on.
That's true. That's true, I swear. That's not right either.
No, that's not true, Gil. What you just said.
Hey, Bob, slide to the side so we can get through.
We consolidated leadership. With our transportation is an example. We consolidated that. We didn't say that all of our...
He listens to his administrators that are right under him. He knows nothing about nursing. Some of these people have been here for 20, 30 years.
I want to make sure I'm honest with you. I'm telling you the way it is. That is a senior leadership position, a bureau chief. We're down one bureau chief, one out of the 8.
I've worked here for 29 years. I've gratefully been retired for 2 years. This has been a place of great pride, and you really didn't have to work here when I started. It was a crown jewel. This was noted by the nation as a model, and it's just diminishing on so many levels. And it's not for our veterans' benefit. I don't know how. Things to do, places to go. They can't replace that. And the chaplain.
I'll call you when I'm done, vet. I don't have a phone on me.
This is what made the veterans' home a great place. It's like, we need to make it a great place again, and it's not going in that direction.
Okay, so I wish you would have been at our outbriefing with the VA certified team last Friday. You know, these are 5 surveyors that do nothing but do surveys of state veterans homes across the country. They came in here and shared with us this is a model facility. We would love it. So you're laughing back here.
I'm laughing because you're standing here telling a group of people that their concerns
don't want to hear this,
are
apparently.
false. No,
It's
I hear
funny.
You're
It's
saying
really
something
funny.
that's
Listen.
Can I finish? You're saying the Vets Home is the standard of all the policies, procedures, manuals, and all the set standards. And you've got employees and veterans standing here telling you that what's going on behind the scenes while they're busy setting that standard is wrong. All the problems they're having with management, all the bad things going on with these people, while they're on the front line holding your standard, you're sitting there calling all them liars, saying that their concerns are invalid. That's what you've been saying for the last 25 minutes.
How many hourly employees were involved in that meeting?
You get them every week in your C4 box. You don't want to sit down with us.
No, you don't.
You
I put in specific ones that never ever crossed. Never.
Saw it. You gave me
Then who picks them up? Why are they gone?
The poppy,
gets those out of there. Fact.
Okay.
the
What?
poppy program is a joke. People get nominated and they never make it on the list of people who are nominated.
The what program?
The poppy program.
Okay.
People get their name put in the box and they are supposed to be posting every name on a list. And those names are not being put on there that people are voting for. Because I have voted for Garrett for the last 6 months. And so have some of my friends. Garrett's name has never showed up on the poppy list once.
Okay, well I can look into that. I mean, if there's specific things like that, then we need to look into it. Yeah, and I definitely would do that.
This is a state-run facility, but they do get VA funds from the feds. But overall, it's run by the state. The governor appoints him, and the same tyrants have been running it for like 20 years.
I have a question. As a retired recreation therapist, how are you going to make sure that the activities that are provided are of therapeutic value, to cover all of what I have here on my shirt, to make sure that that's being taken care of, and to make sure that you're also knowing exactly what residents used to do, like to do, may want to try to further their life and make it better here.
Well, like I say, I've been here for 2 years, and I can tell you that there will be no activities that have been present here that will not be present.
If you guys are just tuning in, that's almost trying to. They've laid off 13 recreation workers and fired a chaplain. They're trying to cut costs when there's a huge surplus. And none of the top administrators have been cut, but yet they get bonuses and they got big high salaries. We got salaried people here working 4 days a week. You've ever heard that before? Salaried, plus they get overtime.
It still is.
But I'm afraid Well, it's a new chapter.
Here, working 4 days a week. You've ever heard that before? Salary, plus they get overtime.
It still is.
Well, it's a new chapter.
But when I've gone out to the community concert, that was one of the big things that I used to do. We used to fill that bus and take extra people. And when I've gone, I still go as a community member. I only see like 5 or 6 people going. Because I don't know whether it's not promoted or what the deal is. Not have enough staff to go around.
I don't know. You guys that are residents here, I mean, provide input on that.
They tell us we can't have a nurse go out, has to take medication.
Wow.
You heard it, guys. They eliminated the nurse who goes on trips with them so they can't get medication, so they can't take them. And everybody here's on medication.
Drivers shouldn't have to be in CNA. Their only job should be driving.
Send a CNA, an actual CNA.
Send an actual
We do send a CNA on those. Absolutely, we do that now.
And why are the drivers getting their CNAs then?
Because they're the CNA.
And it's not safe, my friend.
Why do you say that? That it's not safe?
They
I don't want somebody to walk away from that
take
saying
a job
that we're
as a
not safe.
CNA.
I'll give you an
Making them do
example.
it.
If you're using the driver as a CNA, when we used to go to the ICUPS game, the driver had to park the bus over a mile away from the facility. So what happens if someone needs to go to the restroom while we're waiting to load?
The residents just won't get those kind of activities anymore.
But there's only one CNA.
Right.
Yeah, that's what you said.
Well, we would never have just one person go with a busload of people.
But there's only one person that can help them to the bathroom. That's what they're saying.
So does that mean that they just wouldn't be allowed to participate in activities like that?
We just figure it out. I mean, like we always have done. I mean, we have leaders here that make that happen.
The leaders make it happen. Oh, okay.
And
Wow.
when I first got here, first year we went to State Fair, we left at 8 in the morning and then left there at 4. Now we leave at 9 and have to leave coming back at 2. That ain't right. And if you go up to go through the parade now, you can't go on the regular trip. It used to be you could go on both.
Because when we went on the parade, we were representing the home. When we went to the state fair with the rec trip, it was for us to have fun. But it's not there now.
We can't do both.
I don't know the answer to that.
Who's this guy?
You're employed here?
For how much
I
longer?
am. Yeah.
Let's hear him out.
No, I mean,
Find out tomorrow.
that tells me right there. Now, are we talking about?
I'm here for life. As a matter of fact, I plan on living here.
Well, so do I.
Right. Okay.
So when you say,
Why don't we start being
we'll see about tomorrow, what's that mean? Well, that's not a joke.
That's
We're
not
not
funny.
laughing
No,
at
it isn't funny when
this,
we
this
talk
boils
about
down to jobs. It boils down to money. Boils down to mismanagement, pissing away millions of dollars.
Who's your direct supervisor? I'm sorry to interrupt.
My next supervisor would be Todd.
So who are you?
So, my name's Carl Leto.
Okay.
Communications Director.
For
For the Iowa Department.
Yeah, let the man speak.
Okay. And I'm kind of in the same position as Todd. I came aboard with the merger. Okay. So, and I actually have to spend most of my time down again with the departments and all the other stuff that's happening. But what I'm hearing, for the most part, is you don't feel hurt. And if you're not hurt, that's okay. Now, a little bit about my position. I have absolutely no HR. I basically have no authority over anything but communication. So, how would you guys feel if I got together with about 3 to 5 of you who are still here? Because I'm hearing is you're afraid of it. So, if that's the case, let's figure it out. Sit down, figure out a better way. Because I know we have those reforms, and we have stop them, we have meetings. I don't know all of them. We have.
There's like 6 meetings. They spend like 6 hours or 8-hour days.
What needs to happen?
It's a huge waste of state money.
Well, you don't work here anymore. You know, that fear is, it's still there. No, it's not terrible.
Let's figure it out.
Those of us that are still employed here, if we agree to sit down with you, would you agree to let us have one of our union leaders with us?
Never got that. Essential workers. I didn't get.
We have to understand. I know you want.
Well, he didn't listen when he was out here.
One-on-one.
Big time.
That's awesome.
There you go.
Yeah, see ya.
Yeah, that's right.
This all boils down to people are losing their jobs. They're saying, oh, you've been here for 20 years, you have a college education, rec staff, you're making X amount of dollars. Now, oh, well, we're going to cut your wages by 20 grand because we don't have the money. Okay, you go around and look. See that bus stop down there? Our facilities management bought it as a smoke shop. That's $15,000. Where's the, and he's part of your boss too. You know exactly what I'm talking about. About 3 years ago, 2 years ago. And then
Had to be less than 2 years ago, because I was here 2 years ago.
You know that's not true. Stop it.
Money here. We're talking about wasteful spending. Why are we having to redo the DAC2 Sunday?
Yeah, I don't have to.
But see what I'm saying. This is what everybody says wrong. The amount of
My husband's pregnant.
They
and then people are losing their jobs.
They redid the courtyard, then tore it up to fix a tunnel that had been leaking for 20 years, and then redid the courtyard again. If this was a private business, whoever's in charge of that maintenance team would have been out the door. Seriously, that's last summer before.
So we want to start talking about. We're talking about this. We're talking about people's jobs getting cut and their wages being reduced.
And taking care of the vets.
And it's like, but then you look around, looking at the waste fucking spending.
Tomorrow, I'll make whatever time is available.
Yeah, let's set a
How
time
you
and a
gonna
place.
get employees?
Time and a place. Let's get this done. Sorry.
How are you gonna get employees off their jobs?
Get me a list of my bar and I can ask permission.
Who's willing to go sit at the table with this guy?
If it's something emergent. Yeah.
The commandant said on record, nobody here will be retaliated against.
I'll tell you, we're both veterans. I went to Iraq. I was there 3-4 times. Okay? Yeah, well.
Yeah, why don't you be the one to step up?
You've been there too.
We all have.
Nobody cares more about free speech. This is how we get stuff done.
Well, thanks for having an open mind, at least. Different than Tweedledee over there.
Let's start off with these boys first. I know resident council has.
Hey,
What about the retirees?
everybody. Hey, if you guys are gonna meet, hey Jennifer, if you guys are gonna meet, go around and get different things from different people that you can address, not just your problem or like.
Do we have a time and a place? You guys want to do tomorrow?
That's a little soon.
What time works best?
We would like to get some people from different entities to talk.
That nurse over there was basically pushed out and bullied, and she's a good nurse. She's a sweetheart. She's since gotten a better job, but
Get somebody from recreation.
I'm sure she's given him an earful. She'd been here a long time.